Good morning. In this video, we are going to see about the developmental anomalies of tongue. So, what are the developmental anomalies of tongue? The lesions like aglossia, microglossia, macroglossia, ankyloglossia, fischer tongue, cleft tongue, hairy tongue, median rhomboid glossitis, lingual varices, geographic tongue, lingual thyroid nodule, and thyroglossal tract. All these together comprise the developmental anomalies of tongue. We will see few pictures of these anomalies now. So before moving on to the pictures, what is aglossia? A means absence, glossia means tongue. So the complete absence of tongue is called as aglossia. This condition is extremely rare and it is one of the congenital defect, and it is associated with the other effects also. So aglossia will not appear alone, it will appear in combination with other syndromic structures. So the next is the macroglossia. What is macroglossia? So glossia means, as said before, it is tongue. Macro means large. So the increase in size of tongue is called as the macroglossia. This condition is relatively common when compared to the other anomalies. So this macroglossia can either be congenital or be acquired. By birth, it can be macroglossia. The tongue size can be large, or because of the other conditions like your edentulous arches, or because of any systemic disorders like amyloidosis or any accumulative disorders, or because of your carcinoma, any other lesions, the macroglossia condition can occur. So few congenital macroglossia conditions are muscular hypertrophy, Hurler's syndrome, Hunter's syndrome, Down syndrome, and Beckwith-Weidman syndrome. So syndrome is a condition where two or more anomalies together collectively called as syndromes. So in these syndromes, macroglossia is one of the feature. Then the few examples for acquired macroglossic condition. So what are the examples? Under neoplastic conditions like lymphangioma, hemangioma, granular cell tumor, as said before, protein accumulative disorder, your amyloidosis, and the other endocrine causes like acromegaly and cretinism will also cause increase in size of the tongue. And in few cystic conditions, there may be like your thyroglossal ductus, there may be increase in size of the tongue. So the increase in size of the tongue is called as macroglossia, and it can be either congenital or acquired conditions. So what are the effects of macroglossia? Why in acquired conditions, why does macroglossia occur? So examples are displacement of tooth, malocclusion, difficulty in speech, obstructive sleep apnea, and crenation. What is crenation? Crenation is the cratery form, the scallop form, or your impression of your occlusal aspects on the lateral borders of the tongue is called as crenation. So these are the conditions, these are the effects due to the increased tongue size. Displacement of tooth, malocclusion, difficulty in speech, obstructive sleep apnea, and crenations can occur. So the third condition is the ankyloglossia. What is ankyloglossia? Ankyloglossia is otherwise called as tongue tie. This is because the lingual frenum or frenum attaching is too near to the tip of the tongue. The lingual frenum will be very closely attached to the tip of the tongue, which causes difficulty in speaking, swallowing, and there will be sometimes there will be a problem in having clear speech. So this is called as tongue tie. And the next one is the cleft tongue. Cleft is the break or the failure of fusion of two lateral lingual swellings lead to the formation of cleft tongue. This is this can occur as a part of orofacial digital syndrome. So cleft tongue is one of the feature of orofacial digital syndrome, and this is caused because of the failure of union of two lateral lingual swellings. Fischer tongue. This is a very common feature. This is because of the presence of grooves or depressions on the dorsal surface of the tongue. So there may be either deep grooves or shallow grooves and the fissures on the lateral border of tongue. So this is one of the this is because this is also called as fischer tongue or scrotal tongue. So the next one is the median rhomboid glossitis. So in the middle of the dorsal surface of the tongue, in the shape of a rhomboid, there will be presence of inflammation of the tongue muscles or the tongue structure. So this is called as median rhomboid glossitis. Mainly this is caused due to the candidal infection. So chronic candidiasis can also be called as median rhomboid glossitis. So this will be in a rhomboid shape. This will involve the midline of the tongue and it will resemble a midline in the midline. So next is the lingual varices. It is also called as caviar tongue. The ventral surface of the tongue, the veins running in the ventral surfaces of the tongue will be bulged, which leads to the formation of lingual varices. So next one is the benign migratory glossitis, which is also called as geographic tongue or migratory glossitis. This is nothing but there will be multiple irregularly shaped erythematous patches on the tongue with white rims that enlarge and change shape. So this will be migratory. At one point of time the lesion will be at one place, the other point of time the lesion will be present in the some other place. So that is why it is called as migratory glossitis. There will be irregularly shaped erythematous patches on the tongue with white rims that enlarge and change its shape. So the next one is the hairy tongue. There will be presence of hair follicles or the hairy growth-like structures on the dorsal surface of the tongue. This is one of the most common features seen in the HIV patients. So the last one is the lingual thyroid nodule, which is the functional thyroid gland remnants present at the site of thyroid glands on origin. So this is the lingual thyroid nodule. The picture can show the presence of lingual thyroid nodule. So the last one is the thyroglossal tract cyst. So the descending of the thyroid gland or the thyroid duct there will be presence of remnants which leads to the formation of thyroglossal tract cyst. So which is called as thyroglossal tract cyst, uncommon developmental cyst arising from the embryonic remnants of the thyroglossal tract. This is mainly seen in children and young adults. This is an asymptomatic mobile swelling in the midline of the anterior neck. So this picture, the center picture, the red arrow shows the presence of thyroglossal tract cyst. So this picture also shows the presence of thyroglossal duct cyst. We can see the picture in the midline of the neck. So with this we complete this video. We saw about the developmental anomalies, which includes aglossia, microglossia, macroglossia, ankyloglossia, lingual varices, median rhomboid glossitis, thyroid nodule, lingual thyroid nodule, benign migratory glossitis, thyroglossal tract cyst, and your cleft tongue, your ankyloglossia, etc. So with this we complete the developmental anomalies of tongue. Thank you.